School. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. This is part of symptoms and signs in cardiac disease. Today's topic is what is pedal edema? How will you classify it? How to take the history? What are the common causes? That is the today's agenda. Pedal edema is usually divided into pitting and non-pitting, unilateral, bilateral, painful, painless. So this is the usual way in which you go. So let us, here you can see that this edema is unilateral, and here the patient has got a bilateral edema and it is pitting. Pitting is identified by pressing against a bony point for around 30 seconds and then palpating that area and see whether there is a dipping is there. So now going to what is the definition? Pedal edema is swelling of feet or ankles due to accumulation of interstitial fluid. That is a point to be remembered. This is the accumulation of interstitial fluid. What are the common causes? The common causes can be cardiac, renal, hepatic, endocrine, especially the hypothyroidism. Medications are important cause, especially the calcium channel blockers, and other causes like pregnancy, lymphedema, idiopathic edema, or the cyclical edema can also occur. So swelling can be pitting or non-pitting. As mentioned, it can be tender or non-tender. So when you get a patient with pedal edema, most often you think about cardiac disease. The most important point to remember is cardiac disease. Pedal edema always associated with elevated JVP because the first sign in heart failure, right heart failure, is elevated JVP. So pedal edema without elevated JVP means it is very, very unlikely to be a cardiac cause. Second, pedal edema will be more in the evening in cardiac disease, whereas in renal disease, especially in the nephrotic syndrome, etc., you usually get a puffiness of face and there is edema. Whereas in liver disease, the edema is predominantly there is a abdominal distension or ascites followed by pedal edema. So these are some of the ways in which a clinical history. In addition, you'll be getting symptoms such as cardiac disease, renal disease, liver disease, hyperproteinemia, etc. These are the other ways you will be looking at. So always look for other symptoms and risk factors of heart disease, kidney disease, liver disease, medications, very important, especially the calcium channel blocker, very important. And so you should examine the patient for what is the blood pressure. If the blood pressure is high, always ask for whether he is taking calcium channel blocker. Examine the heart, examine the lung, and examine the abdomen for hepatomegaly and ascites. So what are the tests that you should order for? One is a complete blood test. Check the LFT because liver disease, renal function test, and of course you do a thyroid TSH and a urine analysis for proteins. And in appropriate cases, you may go for chest X-ray, echocardiography, Doppler, ultrasound of the lower limbs, etc. And unilateral edema, as shown here, it is usually due to a local problem, like a venous obstruction, lymphatic obstruction. Venous obstruction can occur in venous thrombosis, but again, the patient will have signs of inflammation and other features of venous congestion, etc. may also be there. Non-pitting edema is classically seen in lymphedema because the lymph contains a lot of protein. It facilitates fibrosis, and that is why in elephantiasis you may get a non-pitting edema. Something which is similar to elephantiasis can occur in hyperthyroidism, that is called the pretibial mixed edema. So unilateral edema, remember DVT, cellulitis, and lymphedema. That is why you should ask about history of pain, swelling, warmth, and a short duration. Think about a cellulitis. Bilateral edema, as mentioned earlier, is classically seen in heart failure, nephrotic syndrome, cirrhosis, and chronic venous insufficiency. Something which is often missed is or forgotten is the chronic venous insufficiency can present with the pedal edema. So management depends upon the underlying cause. Treatment, again, if it's due to a drug problem, we stop the drugs, then think about the underlying disease and manage it. So today we have discussed about the definition, what is pedal edema, what are the common causes, what are the clinical features, history and examination, main investigations, differential diagnosis, and prognosis. Prognosis, of course, depends upon the etiology. So pedal edema is a common thing and may indicate, as mentioned, important diseases: cardiac disease, respiratory disease, renal disease, and liver disease. Of course, edema can occur in pregnancy and other, and also think about the chronic venous insufficiency, hypothyroidism. Hope it was useful to you. Stay tuned. Thank you.